The information provided in this program is of a general nature and is not intended to be personalised financial advice. We encourage you to seek appropriate advice from a qualified professional to suit your individual circumstances. This is a cannabis company special. First, listed firm Cannasouth finally gets medicinal products approved, but how much longer do investors have to wait for it to post some profits? And I sit down with a former executive of Canada's Curaleaf, the world's largest listed cannabis company by market cap. It's Friday the 10th of March and you're watching Markets with Madison, the Cannabis edition. Cannasouth was the first cannabis company to list on the NZX in 2019 with the ticker name CBD. Since then, it's made consecutive multi-million-dollar financial losses, including its most recent annual $8.2 million loss. It's currently in talks to merge with a Bay of Plenty cannabis company called Equalis. I spoke to Cannasouth's chief executive, Mark Lucas, about why he thinks the company is the leader locally.
We're obviously the first publicly listed medicinal cannabis company. We've got the largest market cap of the listed companies at the moment. I believe we've got the most experienced team here. We've got a highly innovative cultivation facility that is, we believe, going to position us well to be able to provide high quality product to New Zealand patients, but also compete globally. We've also got a strong pharmaceutical development side to our business as well. We've got one of New Zealand's leading pharmaceutical development scientists leading that program. We've been doing a lot of work in that area to actually solve some of the other bigger problems in relation to the finished products themselves, the finished oil type products that we currently see that are still pretty primitive, really, when you look at pharmaceutical preparations and not. They're not that bioavailable, and so we've made significant progress in that area, and we're looking forward to start to sort of commercialise some of that intellectual property that we've developed in-house as well.
Yeah, on that, you had your first medicinal cannabis product approved by the Medicinal Cannabis Agency last year. Where does that put you on the path to profitability, because you're still currently a loss-making business?
Yeah, profitability is going to take a little while to get to. These businesses are expensive to establish. We are operating in a pharmaceutical regulatory environment, so very complex, expensive to set up, but the opportunity is huge as well. If we look at some of that data that we've sort of put in our announcement as well, the Drug Foundation estimates there's 266,000 odd patients in New Zealand currently using medicinal cannabis. Of that, only a small percentage are actually accessing it via legal channels. And so if you look at the value of that market that already exists, if each patient was, say, spending $100 a month, you've got a market that currently exists that's well over $300 million existing. If you talk to prescribers in the space, you'll hear that there's almost a 50-50 balance between patients that are coming through that either already using medicinal cannabis and now want to get it from the legal market, or actually have never tried it but obviously want to give it a go. And so the growth potential is huge, but it's starting off at a very small point. Prescriber hesitancy is still an issue, but if we look at the Australian market and the growth rates that you've seen over there, we expect that to happen here. So look, it's a first step. With all of the barriers that we confront, we're confronting them for the first time, or one other company might have got there. So the regulators are still getting a handle on these products as well. They don't fit within the full normal single molecule pharmaceutical framework. So it's certainly a step in the right direction, but we've got more products to add, and we're really excited about this next phase of starting to commercialise more of our activities.
So Cannasouth listed in 2019. In 2022, 3 years later, was the first time you actually had a product approved to be able to take it to market. So when do you think Cannasouth and other players in this industry will actually be able to seize that opportunity that's as large as you say? How much longer do shareholders have to wait?
Well, now it's about getting revenue, and it's validating everything that we've built, really. I think if you look at this industry, it's moving through its phases quicker than a lot of other industries because of the complexity. And so we're moving into a sort of a consolidation and revenue phase as well. And so companies, this is where we find out what strategy they've employed, what area of the market that they've targeted and whether that's the right area. And sort of we're confident with our strategy. We've got a high-class facility that can produce products in one of the fastest growing areas of the medicinal cannabis market. But we've also got longer-term, IP development as well. Some of those pharmaceutical, products that I was talking about before, drug delivery technologies, for example, because it's one thing to operate in this market, it's another thing to actually have a competitive advantage, especially if you're going out into the global market. And that's one of the reasons that, we've proposed this merger with Equalis as well, is to diversify those offerings and to have a more comprehensive and complementary sort of business, from literally from seed to patient.
Yeah, I was just about to ask you about that proposed merger with Equalis. There was an independent assessment report that came out recently, and it effectively said that your company, Cannasouth, was burning through cash and may not actually be able to stand on its own 2 feet financially. So who's benefiting from this merger, you or Equalis?
Oh, look, I think different analysts will look at these things in different ways. It's a 50-50 merger. We think, that both sets of shareholders will benefit from this. What each company brings to this helps unlock the potential of the other companies, what they're currently doing. There's examples of that all the way through. For example, we've got as I say, some of these drug delivery technologies that we've been working on, which is very difficult for an analyst to come in and get a handle on the value, without really deep diving into it. So it's hard for them to quantify. But, adding that to a GMP manufacturing facility that Equalis has unlocks the potential for both companies. So, it's a 50-50 merger, and we believe that the value is for both sides of, shareholders collectively.
Well, best of luck with it. Thanks so much for your time, Mark. Nice to chat.
No worries. Thank you for your time.
Hear that with the world's largest listed cannabis company, Curaleaf, with a market cap of $2.7 billion US. It has more than 140 dispensaries across the US, 29 cultivation sites, and 6,000 employees. Its former operations boss, Stuart Wilcox, has a New Zealand link. He's the chair of a Kiwi medicinal cannabis company called Aura Farm. He was here for the first time recently. We caught up to chat about his experience in a mostly legalised market and how it differs to New Zealand's controlled medicinal market.
There's still an avenue within New Zealand to do things more on pharmaceutical and nutraceutical type products. So there's a good replacements for some of the harsher drugs that are out there today, and you can use some of the more natural drugs that work really well with your body.
What does Aura Farm cultivate and sell? Are you selling flower or tincture oil products?
We're selling flower at this moment. So we go through the genetics, and the genetics will have like a high level of THC or CBD in it. And it all depends on what the customer wants. So we ship it out today. We export into Australia, and we do some domestically. But it's for the most part, it is just a raw product flower today. And once we move into some of the more pharmaceutical, nutraceutical type products, then we'll get more creative on how we process it.
You mentioned your experience with this large North American cannabis company called Curaleaf. I was looking at its website this morning. It has dispensaries in 142 areas across the United States from west to east. What opportunity do you see for retail in New Zealand? Could we be looking to sell gummies, pre-rolled joints and THC flower with as much THC as 28.6%?
You could. And, in the States, it's definitely, there's some real dichotomies there that go from very pharmaceutical to very, recreational or adult use type of product. So it all depends on where you want to take it with legislation. We prefer to stay on the municipal side as much as possible. When you start moving into adult use, a lot of people look at the fast money, and that doesn't really help the products. There's 120 different cannabinoids that sit within the 1,500 different varieties, and there's 20 some different cannabinoids that actually have some good interaction with your neurological system. And so I would say we're going to basically stay much more on municipal, pharmaceutical, nutraceutical type of products. What I love about New Zealand is I walk around, there's no smoke. Very, very few people smoke. And so it's clean, it's neat. My wife loves it here. And I think as you start introducing smoke into the atmosphere, it creates a different vibe about the industry. So I prefer not to see too much of that, unless it's something for medicinal. But most of it can be taken through other means of absorption.
Now, you're also the founding board member of a company called Chew to Pharma. I hope I'm pronouncing that correctly. Now, the aim of that company is to provide cannabinoid supplements for dogs.
That's right, pets.
Is that something we could see in New Zealand?
For sure, without a doubt. So I always laugh about our industry. So we talk about how, is it safe for the pets? And I always tell people, well, we've been working with humans for 100 years, so I guess it's going to be safe for my dog now. And so, but we really should have started the right way. We should have started on rodents first and looked at what was there, and then pets. So within the pet industry, it's strictly looking at how it interacts from a veterinarian standpoint. So we can look at the different types of cannabinoids and how it interacts with a dog. So we look at pain, arthritis, anxiety for pets, and you can see that impact. So then you can just take exactly that, because the systems in a dog especially is very similar to a human, and basically you just change the amount of dosage that goes with it. So you're really doing the testing that you should be doing in the very first place on pets, and then moving into a human.
Wow, my dog's quite chaotic. I think he would benefit from something like that.
We'll send something to you. Yeah.
Look, Stuart, I wanted to point out the regulatory differences between America, where your experience is largely from, and New Zealand, and you've already pointed to quite a bit of it. In Times Square, you can light up a joint, no prescription required, as you please. In New Zealand, you certainly can't do that without a prescription. So how can your experience from the US benefit or add to the market and where it's going in New Zealand when the regulatory landscape is so different still?
Well, the good news, it is so different. There's 39 different states. I have actually 39 examples on what you can do and shouldn't do within the industry. So I like Utah. So if I looked at Utah regulations, very similar to New Zealand. The size of the population is very similar. It's very pharmaceutical. It stays much more on the science base. There's big supplement companies that sit within Utah, which is doTERRA and Young Living. And there's big pharma in that area too. So you get the right talent to come in.
If Utah is one of the states that you've seen do it right, which one's done it wrong?
None of them have absolutely done it right. I think there's a lot of opportunities in all of them. But as I look through it, it's like there's bits and pieces. Like the state did really good in one aspect, but maybe not so much in the other. So sometimes the law enforcement is very good, and sometimes security is really, really good in another state. So you kind of take the best of the best, and you know what you shouldn't be doing for sure, and then you take the others, and then you try to implement that. I think New Zealand's done it right from the very beginning. Certainly, you can always make things better as you move forward.
A lot of the companies here are end-to-end. They grow or they bring flower in from overseas. They typically cultivate, turn it into their own products, and then on-sell that to prescribing doctors. Do you view that changing? Do you see more companies cropping up to take over just one niche part of that process?
I think so. I think as you move forward, it'll be just like any other product. We have a tendency to call it a cannabis industry, and the reality is it could be a pharmaceutical industry that's using cannabinoids. It could be a nutraceutical that's using supplements that are some type of cannabinoid. It could be an energy drink that says I put CBD in it. So I think you get regulated by those different aspects, and then you use this as basically an ingredient. So then it's a matter what's your ingredient format. So I kind of like it to like corn. So if I'm taking corn to eat, it's a lot different than if I'm making corn into ethanol. So it's just, I'm going to take a plant material that I have, and I can put it into a format that's usable.
Thanks so much for your time, Stuart. Really appreciate you coming in.
Thanks a lot, Madison. Appreciate you as well.
Let's take a look at the week that was. The Reserve Bank of Australia hiked rates by 25 basis points to 3.6%. That's Australia's 10th consecutive increase. The chair of the US Federal Reserve, Jerome Powell, testified to Congress, and markets did not like what he had to say.
I think nothing about the data suggests to me that we've tightened too much. Indeed, it suggests that we still have work to do.
Apple's share price got a bit of a boost this week as Goldman initiated a buy rating on the stock. And Tesla cut its car prices again, with the Model X now costing under $100,000, down 9%. I'm really keen to hear your thoughts on this episode. If you invest in cannabis companies, how do you feel about their performance to date? And if there's another industry you'd like me to delve into next, please let me know. Now go put your money to work.